everybody, it's Glacia with Prego Vlog again. I think this is video number 5, and I'm going to tell you about my second pregnancy. I got pregnant in November of 2010 with my second child, Vivian. She was born in August of 2011. She was 8 pounds 1 ounce. And she was born at 40 weeks and 6 days. I was induced again. When I went in to be induced, I was having my bloody show that morning. Before I was called into my room, I went to the bathroom and I was having my bloody show, and I was like so disappointed. So I was like, oh, I wanted to do this normal, and she probably would have come in a couple of days. But you know the rule. Most doctors won't let you go past 41 weeks, and it was a Friday. She was born on a Friday, so it was like I tried to get him to, I tried to talk him into like being like, it'd be really great to wait, until Monday. Can we do it on Monday? And he was like, no, I'm really not comfortable with you going that long. Who knows? Maybe it was because he wanted to have his weekend free. I don't know. I know that there's a lot of theories on, whether or not doctors try and, force patients into induction when they're at that point, just because, who knows? I don't try to get into that. Anyway, they broke my water at about 9 o'clock in the morning, and nothing really happened. So about an hour later, they started me on Pitocin, even though I really didn't want to be on Pitocin. They started me on Pitocin because the water was already broken, nothing was happening. I went into labor, but I couldn't feel any of it. And I was in labor without feeling any of it until I was about 4 centimeters dilated. And then it kicked in like a mule. Because all along, for the 2 hours it took me to get to 4 centimeters, they were like, oh, you can't feel these contractions? So I was on a monitor, and they were like, look at it, you're having a contraction, can't you feel that? And I was like, no, not really, I can feel it, but it's not painful at all, just tightening. And they were like, oh, cool, crank it up. And so I was like maxed out on Pitocin. And so I don't know if that stuff has a cumulative effect or not, but man, when it hit hard. And so I made it to about 6 centimeters before I got an epidural. We'll have another talk about epidurals, maybe next. Maybe my next video will be about epidurals. So I was induced at like 9 in the morning, and I got my epidural at maybe like 3. And she who's walking behind me now.
Mommy up.
Mommy up?
Yeah.
Okay, let me finish this, okay? It'll take me 1 minute. She was born at 6:59 p.m., 8 pounds 1 ounce, perfectly healthy, wonderful, and beautiful. I didn't even have to push. That was the funny part. I had really bad reflux, and they were like, okay, you're 10 centimeters, let's try a practice push. And I was like, and I pushed, and when I did, it pushed all this reflux up into my mouth and burned my throat and made me feel sick. So after I was done, she was like, oh, that's good. She's dropped quite a bit, because she wasn't even engaged. She was still really high. She was not down all the way. She was like, okay, it seems like she came down a little bit. And I was like, I'm totally going to be sick. And so she threw one of those puke bags with the ring around it at Doug, and he caught it and put it up against my mouth, and I was like, kind of off to the side. It was terrible. And you think that's funny, because that's how you were born. That's now her favorite noise, when we go, bleh! She usually thinks it's pretty funny. Anyway, so I puked my living guts out. And she was like, oh, I'm so sorry that you got sick. She was so sweet. Oh, I loved her. Her name was Cheryl. She was like, okay, well, let's see if we can try again. I'm so sorry that you're sick. And she spread my legs, and she was like, oh my God. And she crossed my legs and started I could feel her pressing up on something. Obviously I didn't feel any of this because I had an epidural. And she was her reaction made Doug look down, and he was like, whoa. And I was like, what? And he's like, she's out to here. The whole top of her head was out. So I was laughing. I was cracking up, because this just seemed really humorous to me. And so she's got my legs crossed, and she's pushing on Vivian's head, and she's like, stop laughing. Every time you laugh, she comes out a little bit more. And I'm like, Cheryl, don't you want to deliver this baby? And she's like, yes. I'm like, I know you could. She's like, yeah, she used to be a practicing midwife. That's what she used to do until she decided to become labor and delivery nurse. She's like, no, we have to wait for the doctor. That's what he's paid for. And so he comes in the room, and she's like, you know, okay, let's go. And he's like, okay, well, let's break down the bed and blah, blah, blah. And she's like, no, we don't have time for that. So she pulls my legs apart, and he's like, oh, okay. And so he straps some gloves on and like puts a scrub around himself because he's wearing, you know, like a nice shirt and tie and whatever. And he's like, oh, that's really good. Looks fantastic. Excellent perineal stretching. And he kind of like tapped on either side, and V just kind of like came out. And I'm cracking up the whole time, and he's like, okay then, here's your baby. It was awesome. I would do it that way 100 times if I could, you know, laugh a baby out. I know that's really like not a fair story, but there you go. So that was my second pregnancy, and this is Glacia, and I'll see you next time.